So I want to just explain through a little dynamic diagram here the importance of why this is different, perhaps, from ways you've made changes before. What we have to understand is that in a complex system, there's potential for things to go wrong all the time. Just because we overlook them, but also because something is missing, we can't get it in a timely way, or we decide our judgment that day is, as far as we can tell, good, but we just don't perceive the things that really need to happen for that child to make a significant difference in their chances of being readmitted. The point is that it's fine to have a standard. It's fine to say something is as good as it can be or is actually outside and not up to standard. But the trouble is, unless you look at the whole system, what happens is that over time, those places and occasions when things didn't go right will recur. And maybe you've had that experience yourself doing multiple root cause analysis and you think, goodness me, we still haven't fixed this particular part of our problem. So in quality improvement, we're really keen that we look at the whole system, even parts that we think are working quite well, and that we take action across the system to narrow the variation in what's happening, making it easier to do the right things at the right time in the right way for the right person. We narrow the variation at the same time as moving it into a better place. So we've changed the risk in the system of ever going outside that standard that we decided was what was necessary. Example is you will probably have children at the moment who are not getting all their necessary annual reviews. You'll have some children whose eyes aren't being looked at, their retina aren't being checked, who perhaps haven't had their weight done for over 12 months, or perhaps only had 3 of the 4 clinics. The point is that all that adds up to an unreliable system. So we want to design a system that means every child gets everything they should have within the 12 months. And that may mean that we have to do it within 10 months to give ourselves a little bit of flexibility around holidays and cancelled appointments and so on and so on. But our aim is to make sure it happens for everybody, not that it happens for 80 or 85% of the children, because other things won't be happening for some of those kids too. And that will, in the end, produce a much poorer outcome for them in their lives, in their opportunities, and never mind in their physical and mental health. So, good book that you might want to check out, which is free online. We'll give you the link for it. This is just one diagram out of it, but I think some of you would find it really interesting to read. But we've taken it to show that actually in healthcare, it's very complicated, far more complex than any other work system. And there are sort of 5 levels that you can think of, where care is absolutely spot on as envisaged by the standard, where we comply with the standards, but we didn't quite get it right. Maybe we were a little bit less connected with the patient than they wanted us to be. Maybe we overlooked 1 or 2 minor things and we catch up with it quite quickly, but it still didn't happen as it should have done. And so on and so on, down to the red box here, which is, oh dear, this was not good, not good. And some patient has perhaps had a serious admission because we've overlooked things and their care and their condition has deteriorated such that they've needed to come into hospital. The question we need to understand here is, well, where and what do we do? So here it's useful. If it's just a bit unreliable, but to all intents and purposes, the system's good, then we just need to go in and optimize what we're doing. But sometimes if things are very, very seriously not organized well or not delivering close enough to the standard, we need to intervene to manage that risk. We need to rethink ourselves about how to design the system. And here I've just put some things we'll talk about during the collaborative that we might think to use. So if we're just optimizing the system, we can use process design, we can use human factors analysis, we may want to look at reliability and failure modes analysis. It's something I'll talk about. If we're intervening to manage risk, much more important that we go right back to square one and analyze what's going on and what should go on and start to map out what we're doing.